for very long. It's a small room. We've got lots of people here, and most of the purpose of this afternoon is for you to be able to talk to us and ask us questions as well. But there were just a couple of points I did want to make about specialist services that might just help set the context. Yeah. Now, none of this is new on this slide, but it's just 4 principles that we think about when we think about the specialist services. So what do I mean when I'm talking about specialist services? Well, Imperial College Healthcare NHS Trust runs 5 hospitals. 3 of those hospitals are in the borough of Hammersmith and Fulham. So that's Queen Charlotte and Chelsea Hospital, Hammersmith Hospital and Charing Cross Hospital. So in thinking about specialist services within Hammersmith and Fulham, these are the sort of principles that we've been thinking about. So the first is how we make sure that across the borough you can get good access to local specialist services. So an example of that would be, rather than having to go into the hospital to see specialists in the outpatient clinic, how do you get those services more locally? So one of the examples of that in Hammersmith and Fulham is that we have community gynaecology services. We also have community paediatric specialists coming out and working within general practices, like in Tim's general practice, so that rather than coming into the hospital, you can get access to specialist services in that community setting. So that's our sort of first principle that we've been working on. The second principle is that where you need a critical mass of services, to get that expertise so that the specialists have that expertise and they see sufficient numbers of patients to keep their hand in those sorts of specialist services. They're the ones that we're looking to centralise. Now, a good example of that in Hammersmith and Fulham is our heart attack centre. In Hammersmith and Fulham, we have our major heart attack centre for North West London. We don't have one at St Mary's Hospital, we don't have one at Charing Cross Hospital, because it's those sorts of services that you need to centralise so that when you get taken to that hospital, the experts there have all the equipment they need, all the expertise they need to treat you on the spot. So that's about centralising specialist services. The third principle there is about making sure that the services we provide are well linked up to the primary care services, to the local government services, to the mental health services, to the community health services. And we know that we're not expert at that at the moment. It is quite fragmented across the various service providers. So how do we better organise our services so that it's more seamless care for people using our services, so that you don't have to repeat your story every time you see a new clinician in a new setting. And then the fourth principle there is about how we can really leverage the advances in technology. So genomics is a really good example of that. With some of the work that's going on in genomics, rather than just getting a generic set of chemotherapy services, we can really start tailoring the services to your particular genetic footprint so that we're able to really target the care that you receive. So they're the 4 principles we've been thinking about within our specialist services framework, and that's reflected within the STP document that's been drafted. The second area I wanted to highlight is some work that we've been doing in Hammersmith and Fulham with the GP Federation, with our friends at Chelsea and Westminster. It's great that Dominique is here from Chelsea and Westminster, and also with West London Mental Health Services. So as a group of 4 organisations, we've signed a memorandum of understanding to say that we want to work much better together, much more closely together, to think about how we would provide really joined up services across the borough of Hammersmith and Fulham. So we've got a population of close to 200,000 people living in this borough. If you look at the number of staff providing services, close to 20,000 staff, and that doesn't include all the carers that Tim talked about, 31 different GP practices, and between us we've got revenues of about 200 million. So to give you an example of what we've been doing together, we've looked at the group of patients that live within that borough that have used our ED services either at St Mary's, at Charing Cross, at Chelsea and Westminster, or at West Middlesex. And we've looked at patients that have used those services more than 10 times in a 10-month period. Some of those patients have used our ED services more than 100 times in that 10-month period. So what we did was we got the clinicians in the room from all of those 4 different organisations, after going through all the information governance processes that we needed to go through, to say, if we could better organise our services, could we deliver much more streamlined care for those 71 patients? And we found some things that we're doing really well, and we found some areas that we could work much better on so that those patients didn't turn up over 100 times to emergency departments, because that's not where they're getting the best care. We can look after them in the community or at home. That would be much better than people getting really sick and having to come into an emergency department. So that's just an example of one of the programs that we've got underway at the moment within Hammersmith and Fulham. And then the last area I just wanted to end up on was Charing Cross Hospital. And this is where there has obviously been a lot of controversy within the Hammersmith and Fulham area. So I thought we'd put it right on the table to start the discussions and just point out a few things that are articulated within the STP. So we've talked about Charing Cross Hospital being a local hospital and having an A&E service appropriate for a local hospital. There are a couple of key points that the STP makes about this. So I just draw your attention to this second dot point. And what it says within the STP plan is that we have made a commitment as a group of health and care providers to review the assumptions that underpin shaping a healthier future for acute services across North West London, to progress with the delivery of local services, so services that mean you've got access to the right services in the community setting, so you don't need to come into an acute facility before we make any further changes. So that is point number 1. Point number 2, which is this second dot point, is also incredibly important. And what we've said as an STP footprint is that we will work jointly with local government to agree a model of acute service provision that addresses clinical safety and quality concerns and expected demand pressures. And we would do that over the period of the STP. What does that mean for Charing Cross Hospital? That does mean that there would not be changes at Charing Cross Hospital to the A&E department during the 5-year period of this STP. And that's really important because we need to ensure that we have the right services within the community, within the local setting, so that we can see that demand for acute services is going down, demand for A&E services is going down, before we make changes to our acute bed setting or to our A&E services. So that is what the STP says for Charing Cross Hospital. I think that's really important to underline, because I'm not sure that that is well understood at the moment within the Borough of Hammersmith and Fulham. And I'm sure that is an excellent point to hand across to Stephen. I don't think